Good afternoon, everyone. My name is James Gonzalez, and this is my podcast, James Laid Out, and this is my guest, Aaron. Aaron, can you just tell the guest, everyone, what is your specialty?
Well, right now I'd say it's in pharmacy, right? Because I have one more year of pharmacy school left, but I'm on the podcast for my coaching today, right? So that's something we could go ahead and talk about. But I guess the difference between, the normal coach and I would say, let's say a coach like myself, even though I'm young, I mean, I'm not doing it for a living. I do it because I like it and because I'm pretty decent at it. But I think the biggest separation would be doing it the healthy way, right? The real conservative way, along with I could, put it in quotes, this, like I said, the safer way, because let's be honest, when it comes to competing and whatnot, there's always going to be health risks, right? So the education on the things helped me with the trial and error for the coaching that we're going to be talking about today.
So how long, like your experience, you started off in bodybuilding, when did you start like your bodybuilding, your training?
Bodybuilding, let's say I started when I was around 20. I really didn't start coaching until I was about 23. I competed when I was 21. Yeah, I took second place in classic, but yeah, I've only competed once though. I've been sticking to the coaching longer than me sticking to the bodybuilding.
I mean, I think like sometimes you need a rest, and I think you have so much to offer with that pharmacy background, and like one thing I like about your training is you keep learning. And I think a lot of these coaches out there, they're just like, no, I did it this way 5 years ago, and it's like, well, yeah, but you didn't change. And so yeah, they have 10 years experience, but they stop learning after 2.
Yeah, exactly. And I think that's what's really important, right? Is people not staying or hindering their progress from knowledge. Because obviously you've heard about coaches with these cookie cutter diets. They'll give the same PED protocol to, every single client, instead of adapting as to what's changing, right, when it comes to the client's body, how they're reacting and whatnot. So they always have their own timing, right, instead of adapting. And I think that's what makes, that's what separates, kind of a coach from a great coach, is the ability to adapt, right? You see the way someone's reacting, okay, you know what, are they reacting too fast? Let's go ahead and slow it down and whatnot. So you go ahead and go on from there. Because there's something that you can't teach, and I think it's, on top of everything, it's instinct, right? Because these coaches chose to kind of not learn or continuing to learn about what they're doing, it hinders their progress, right? So they really don't have the eye anymore, and they're not really trained to see those types of details, X amount of weeks out. You know what I mean? Are they going too fast? Do we need to speed things up? Things like that. Everything is on their own schedule that they have set out kind of for every single client. You know what I mean? But everyone's different.
And one thing I did notice, I like, because I see you have your clients for so long. Like, it's just like I saw you the other day training with that guy, and it's like you've been coaching him for, wow, how long?
Yeah, David started, I think, when he was 19, and he's been with me for about 5 years. But the progress that he made was crazy because he's in the military, right? So it's a little difficult to coach someone that's in the military that's doing PT every day, because I'm a calories in, calories out type of coach, right? So because he had so much energy expenditure, we really couldn't have a true off season to where he could make that crazy progress. But when he had first started with me, I think he got 5th place, right? And then he decided to do another show, and he got 1st place out in Hawaii, and it was in a pool of 7 competitors. I was like, wow, you know what? This, he brought a good look to him. And so that's what's important too. Sometimes it's not even about the coach. Sometimes it's about how consistent you are with that one person, right? Because any coach can be a good coach, but you have to have a good client at the same time. And I think, with the clients, I'm not saying I'm this big time coach, right? I just kind of do it locally. But the clients that I've had, or the clients that I end up getting for bodybuilding, they know that there's a certain standard of conditioning and sacrifice and suffering that it's going to take to get into that conditioning. And what I like is that they already know what they're going to get themselves into, but that sacrifice is going to be worth it in the end, because really, man, I'm all about winning. Like, I want everyone around me to win. You know what I mean?
So, what would be your ideal client? Like, what would what's your ideal client? Like, you can.
That's the thing. I really wouldn't say there's an ideal client. I think it's just whoever wants it more. And I think, especially with bodybuilding, because no one is forcing someone, to malnourish themselves the last few weeks before they get, they step onto stage and whatnot. Like, no one is forcing them. They have to have that drive, right? So as long as I see that my client has a drive and they want to win, really, that's all I really need, because it's like, I'll just take over from here. Just pay attention to the details and do what I tell you to do, and that's it. Because really, when the communication is there, really there should be no problem when it comes to peaking someone, when it comes to someone's off season, when it comes to their health outcomes, all of the above.
That's cool. Since you've been in this, and I think you've been changing and you gotten different clients, is there anything like in fitness or health that you kind of changed your mind towards?
Yeah, being functional.
Oh, okay.
For sure, being functional, because I would say maybe a couple of months ago, I would play basketball at my school rec, right, with my classmates. And I can move fast, whatnot, but man, I get tired quick, right? Because I don't run. I'm on the treadmill, walking at an incline. That's my cardio. And I used to be an athlete back in high school, right, where I was running all the time, so I could run. But now, I think being functional is very important, because as the years go by and you just continue to build muscle, right, you get slower, you move slower, you feel a little more sluggish. And one day I woke up and I was like, you know what, I don't think I want to feel like that anymore. So this was about 2 weeks ago, and I just started running on the treadmill again, and I hadn't ran in like 9 years prior to playing basketball. So.
And do you think you're going to transition that to more your lifestyle clients, or is it going to be
No. That's just for myself.
Just for yourself?
Yeah, that would be more for myself. But as far as the coaching goes, when it's bodybuilding, it's just bodybuilding. I won't have someone try to be a functional bodybuilder. I feel like if you want to be a bodybuilder, that's just kind of what you have to be. You know what I mean? Mm-hmm. You can't really be an athlete, because you're either eating for performance, right, or for the appearance. You can't have the best of both worlds unless you're, a genetic freak, right? You don't see, there's very few NFL players that are just jacked, and they're great at the sport, right? So that's what I take into consideration for the coaching too.
So I guess like if you're coaching like an athlete, abs, you don't care about abs then.
Well, that's the thing. Yeah, no, I care about the performance.
Yeah. So
right?
I mean, I think like a lot of like since you do mainly like if you were lifestyle coaching and stuff, like I think abs are overrated. I mean, I think some of these people are like, I see all these people that are trying to be like, they're trying to get healthy and they're like, they want abs. It's like, well, once you get to that level of like low fat percentage, you're gonna hinder your workouts, which is gonna hinder your muscle growth. Which it's so much harder to put on a pound of muscle than to lose a pound of fat. Like me, I can be like, I'm gonna go eat ice cream. Yeah, I might gain a pound of fat, but I'm gonna have a badass workout. I might put on a little bit more muscle for a little bit. Yeah, I'll be a little chubby, and then when I want to lose that fat, it's just like, okay.
Yeah.
It's just.
Yeah, and that's the thing. I think that's what I'm trying to find too, is that balance between kind of being an athlete and a bodybuilder, because by doing that, I'm able to be more flexible with my nutrition, right? Because I haven't ran in 9 years, dude. And because I started running 2 weeks ago, I've already trimmed a lot of fat. And the thing is, I'm more flexible with my diet, but I'm still making progress. So that's one thing for me, at least. But as far as the athletes, one thing that I would change, or one thing that's changed my mind, nothing really. I've been consistent with everything. There's nothing that I wouldn't tell them to do that I wouldn't do. Really, it's always the same mission. there are some things that I don't agree with when it comes to, the athletes wanting to sometimes make weight even when it's really, really difficult. I'm like, hey man, you know what, there's a risk, and they want to take the risk to drop that weight. Like you had mentioned earlier, diuretics.
Mm-hmm.
Diuretics are something that's dangerous. You wanted to go ahead and talk about that, and I would agree with you, because really you're supposed to use mild or lower than mild type of diuretics, right, to flush that water out of the client X amount of days before show day, right? So these people don't understand the severity that it could come with, because you could, cause an acute kidney injury, for an example. Obviously deplete the electrolytes, but that's what leads to the kidney injury.
Yeah, and I mean, I think also messing with electrolytes, and you have the heart problem, which literally, I mean, people have died because of the use of diuretics, and I think people don't understand how dangerous diuretics are. I mean, I heard of a coach putting an 18-year-old, 19-year-old physique competitor on 7 different prescription diuretics a week out from a show, and this guy, he won a week. This guy killed his competition, and I was like, for what? Like, he was a badass, and I was just like, you almost died.
Yeah, you see, and that's the thing. I think when it comes to the bodybuilding world, right, it's kind of like a black market world. It's kind of underground. Even though you and I know about it, there's not many people that know about, true bodybuilding. And so when it comes to the bodybuilders, the underground guys, the bro science guys, they really don't know the health risks that can come with taking all of the PEDs, right? Because obviously PEDs are always going to have a risk to them, but if you do them conservatively and you dose them appropriately, right, within a time window for competing, then really later on down the future, yes, you know what, it is going to take a couple of years off of your life. I'm not going to lie to you about that. But as far as the health, if you take care of it post psychotherapy as well, then there's no reason why, someone shouldn't be fine later on in life.
When you bring up a really good point, post psychotherapy, you know what? I see so many coaches just like running their clients, or they don't even have a clue on doing post psychotherapy, and their post psychotherapy is like Novodex, and it's just like, but like they're running like something that was a long ester, and it's like, well, you never really got off. You just stopped taking injections, and then you got back on, like, and they don't understand the half-lives or the, and I think that's a problem. Like, what kind of PCATs, what kind of protocols, or what kind of things, medications are there out there for PCT?
Well, I mean, the 3 primary ones, right, I guess the holy trinity. Obviously, you're going to need to get your fertility back, right? But it's only going to be temporary, because anything that you're going to be injecting synthetically, it's going to go ahead and suppress your natural hormone, right? So obviously, you would use the HCG, you would use the Clomid, and you'd use the Novodex, right? But depending on how you dose it, it's what's going to be different depending on what that client's goals are, right? But it is important to do the post-psychotherapy, because obviously your FSH and everything is shut down naturally. So you need to go ahead and reset those receptors, those androgen receptors. It could take a while. Usually a post-psychotherapy that I would like a window is anywhere from 6 to 12 weeks.
Oh,
right,
okay,
depending on that person's blood work from post cycle, right, to, let's say, after their post psychotherapy. Well, I like to go ahead and gauge 6 to 12 weeks, but then it also depends on the client's goals, right? Do they want to be fertile again, right? Do they just want to reset, right? But all of it is the same thing. It just depends on what the client's goal is when it comes to after their competition or their cycle.
And I think like one of the things like bodybuilding, I mean, it happens a lot. People just do one show, and I think like that messes them up. Like they do that one show, and then they kind of just get off everything, and then their body just goes to a completely different direction. And I think that's why we lose so many people in the sport, because they don't get that advice after. And then they could have probably been something, but they had like a bad coach, or they had a bad rebound, and then like they messed everything up.
You see, it could go both ways, right? Because Adherence is a really important thing too.
Yeah.
Right? The coach can, what the client shows sometimes isn't what the coach sees.
Yeah.
Right? So let's say someone, whatever anabolic that they're using, whatever cycle they were put on, adherence is important, right? Following the cycle. Because I've heard so many stories where someone will say, "Oh, you know what, this coach messed me up," and blah blah blah. But no, you know what? It costs money to do the post-cycle therapy too. But people don't want to go through that post-cycle therapy. They just want to go ahead and jump right back on. And also for the coach too. Yeah, there are some. I'm not gonna say there's bad coaches. They're just coaches who don't have much knowledge and don't believe in it because they really don't know, the medical side of bodybuilding. But if your coach isn't resetting you, let's say at least once a year, I would say twice minimum, because I like to reset my clients twice a year, then I mean, your hormones are going to kind of be shut down. It's going to be real difficult for them to return to a natural state if you ever come back to that later on down the line. But really, not many people go back to the natural state down the line, which is why, TRT is something that we're going to go ahead and talk about. So
yeah, I think TRT is a good thing just because we have a lot of there's some pro athletes now that are just on TRT, and I think a lot of the younger generation is like, I'm just gonna do TRT because this pro athlete's on TRT. It's like, yeah, but that guy wasn't on TRT when he started. He's maintaining his muscle with TRT, and I think TRT is just maybe it's used, but it's not used correctly in a way. It's kind of it's there's still side effects from TRT. You're still playing with the hormone and all these things. But on the flip side, there are people I think a great example is nurses. They don't sleep, and so there's things in their environment that are affecting their testosterone level. So sometimes people do need TRT. Now, what are the side effects of testosterone replacement therapy for someone who actually needs it for, like a type 1 diabetic and that kind of stuff?
The side effects, obviously you could expect your cholesterol to raise slightly, your blood pressure to raise slightly, but really, obviously, prostate cancer is linked to long exposure of testosterone. That's a result of long exposure for testosterone. But the thing is, I read a bunch of articles. So I had actually read about an article about a week ago saying that doing TRT appropriately, right? And this was from, I like the Anabolic Doc.
Yeah.
I used to watch him a lot back when I was 20, 21 years old to learn what I was getting myself into and whatnot when it came to competing in the bodybuilding. So he had put up an article about a clinical trial that started patients on TRT years ago, and it didn't lead to the growth of, prostate, or where they have prostate cancer. So that was just one article. So I think the thing is that TRT, it's our hormone. It's a hormone in our body, right? Obviously, we're using a synthetic hormone, but nonetheless, it's still a hormone in our body. If you do it appropriately, right? The true TRT is about 150 milligrams to 200 milligrams, of a long-acting ester testosterone twice a week, right? Or once a week, sorry. Split twice a week. And so if anyone is going really above that, that is not considered TRT, unfortunately, right? Because it's testosterone replacement. It's not performance enhancing. You know what I mean? So.
But I think also with the medical community, I've had clients that are like, oh, my level's 200, 300, but the doctor's like, no, I don't want you to give it to you. And I think that the social acceptance of TRT is not there, causing people to go to the black market.
No, I don't think it's because of that. It's not that the doctors don't want to give it. It's just that the doctors don't have the knowledge to give it. I've tried to find a good endocrinologist in the past before, and it's never happened, right? It's never happened. I've had 3, right? Until I had to start doing the research myself. Okay, what is it that could go ahead and help me, restore my FSH levels, raise my testosterone once again and whatnot. Because obviously the post-cycle, you're not going to have the same
Mhm.
testosterone levels that you did when you were on cycle. So you are going to have, that lackadaisical feeling, fatigue, tired, unmotivated, all of the above. So when it comes to that, I mean, it's all on the dose too.
Yeah, I just think like you know they have this like this bad if it's a type one, yeah, you should take it. But there's some people that actually do need TRT because the genetics or you know certain factors in life, stress and certain things they can't control. So why not control it? And I think men just need to go out there and be like, hey, you know what? Get your blood work. Is that a problem or is it something else? And then try to find someone. But I do notice like endocrinologists, they specialize more in diabetics and
Of
more in the
course.
type 2 diabetics
Mhm.
because that population is like there's that's basically what we see in the hospital.
No, yeah, I know everyone that's got a family member for diabetes.
Yeah, and it's a little bit crazy. I mean, so like, and then I think also like in El Paso culture is like most men are like, no, I'm good,
No, yeah,
and
no.
it's like okay. And I think the correlation between low testosterone and diabetes. That I think that some, not all, maybe like a small like 1% of those type 2 diabetics may just have low T, and that's why they don't work out. That's why they don't feel good, and that's why they become diabetic.
That's true too, but you know what?
It's slow.
Insulin is the most anabolic hormone in your body, man.
And I think insulin's a really fascinating hormone, and I think it's kind of you can see that transition from the bodybuilders from the 80s to the bodybuilders now with the use of insulin and growth hormone, and then now you have the use of like diabetes drugs and weight loss and health. What is your take on these on like Ozempic on these other drugs?
I mean, I've never trial and errored with Ozempic, but obviously that's the money market right now. I know people who take the Ozempic. It suppresses their appetite. It kind of ruins food for them because you get nauseous, you lose your appetite, and that's the point of it too, right? It's to lower the A1C. It's like you said for diabetics. Metformin I think is great. It's something that's mild that could be used in the bodybuilding world. Insulin, like you said, it is being used heavily now when it comes to the professionals and whatnot, right? But when you mix insulin and you got diuretics in the picture, that's when it gets dangerous, right? So, like for example, Milo Sarcev, right, the coach, he likes to mix insulin with the diuretics, and it sends people to the hospital for what we were talking about, right? You got the hypoglycemia along with the dehydration. It's like you're going to be battling both of those animals when you go to the hospital. It's tough.
Yeah, I mean, because you have the diuretics that mess with the potassium, and then insulin puts the rest of the potassium into the cell.
Mm-hmm.
So you have this like electrolyte imbalance, and then you can have heart problems and all those things. I think this do or die mentality, it shouldn't be so hardcore. You can do it safely, but it shouldn't be like I'm gonna die doing this sport. It's like you can do it healthy. Just gotta like do it smart.
I think, yeah, I mean, I wouldn't use the word healthy. I would just use more of a balance, right? So, because like I said, when it comes to this, it's all, there's always going to be a health risk. It's kind of like everything, like for example, right, let's talk about AI drugs, right, or let's talk about SERMs and whatnot. When it comes to estrogen and testosterone production, those AIs, let's say to prevent gyno or whatnot, right? Because obviously the overproduction of testosterone leads to gynecomastia in males, and that's how you can tell, obviously. So man boobs, obviously, if someone's on it or not. When it comes to those drugs, trying to balance that estradiol to the testosterone, it's like it's never gonna fix itself because it's a gland, one. So with all these SERMs or AIs, it's kind of like you're putting a Band-Aid over the cut, but the cut's still going to be there in terms of that, so.
I think like, estrogen blockers and AIs and all those like Novadex and Clomid, they're really important they're a popular drug, and I think people need to use them because I know a lot of guys will be like, I'm not doing TRT, but they're not regulating their estrogen. Like, oh, I don't get gyno. It's like, well, yeah, but estrogen also messes with other things. It's going to have weight retention. I mean, it's going to affect your prostate cancer, and the correlation between like high prostate and high estrogen. There's a link, And so then you notice.
Well, I would say there's a link more with testosterone for the prostate.
Well, I mean, but it's all hormone related, and I think the body is meant to stay in balance. And when you start messing with one system, you're gonna mess with another.
Of course.
And then that's why I think, like, if you're gonna mess with your testosterone level, you have to at least get your estrogen level checked to know what the hell's going on, because there's certain things, like some people are, I guess, lucky or unlucky, where they get gynecoplasty and like, oh, you know what, I need to correct this.
Mm-hmm.
Some people don't.
Yeah.
And some people are like, I ran all this stuff, and they don't get that. And I think it's just because you don't see it doesn't mean there's a problem. There isn't a problem. So, which I think is oh, but before we run out of time, I really want to talk about the use of thyroid hormone as a PED. Like, what are the side effects of people using the thyroid hormone?
Obviously, you shoot your thyroid gland later on if you're overexpressing that hormone, right? Because it's putting it in that. And thyroid hormone specifically is very, very sensitive, right? Because there's, let's say, for example, levothyroxine, right? It's obviously T3, right? And it's prescribed. There's different dosing. There's brand name and there's generic names. Just to show you how sensitive someone's thyroid hormone is, someone can not react to the medication, right? Let's say if they're using a brand name, but then they'll react to the generic name, or vice versa. So just to show how sensitive that thyroid hormone is, especially if you start to overexpress it, and you're doing it for a continued state, and you're putting, and you turn it into hyperthyroidism, that's when you start getting, hot flashes and whatnot. And so that could lead to serious health problems, and you got to give a beta blocker in case if against that, extensive of an emergency. But in the long run, it really isn't worth it. There was some woman competitor who actually posted a story about her having thyroid problems, and I'm thinking to myself, okay, for sure, because she was a great competitor. I saw her figure, she was great. And I thought to myself, did this woman not know the risk of whatever her coach was giving her? Most likely T3, right? T3 is very big in women's competing. I've never given that actually I gave it one time on a protocol. But as far as for the women's competitors go, T3 is heavily utilized, and when it comes to the thyroid, like I said, if you just overexpress it for a certain amount of time and you're continuously doing that, you're gonna shoot it. It's just like testosterone, right? Let's say you're overexpressing your testosterone hormones, right? You hit a crash, your testosterone crashes, your natural levels crash, and that's when you really kind of have to put yourself in that post-cycle therapy. Oh, you know what? I'm not responding to anything, right? I got to go ahead and reset my hormone. But the thing is, the longer you do it for without having to do that reset, the more difficult it is to go ahead and get back to that natural state.
And I think one of the biggest things is with the thyroid hormone, since it's a pill, people don't think it's as dangerous.
Yeah.
They're like, oh, it's just a pill. And it's like, this is a very dangerous pill. Like, you can have that thyroid storm and almost die, So it's not something to be playing around with. And I'm so glad that we brought this up, because I think so many people think PEDs, they're dangerous. Like, they're not something you play around with. You need an expert. You need an expert that also keeps on learning. Like, your coach needs to always be learning. And I like that about you, because you're going to school, you're going to go be a pharmacist, and then you're going to be that guy that's always reading. And so, like, I like to see that transition in you, and then the way how motivational you've been.